We're joined today by Abbie Newman. She is CEO of Mission Kids. For those that are not familiar, what is the role that Mission Kids plays?
Mission Kids is one of 40 child advocacy centers in Pennsylvania. And for those who are not familiar with a child advocacy center, what we do is to facilitate the investigative responses for cases of child abuse in a county. And we facilitate that response between the county's district attorney's office, the Office of Children and Youth in each county, and the police. And the reason that we act in the way that we do, we're all independent, we are neutral. And our role is to make sure that a child is not re-traumatized by the systems that are actually put in place to help them. So when a child reports abuse in areas that don't yet have a child advocacy center, the child is forced to repeat their story over and over again in places like police stations or district attorney's office. The child often will not feel that they're being believed because of where they're being asked the questions over and over again. And so they get re-traumatized when they retell their story and they shut down. The Child Advocacy Center is neutral, we're child-friendly, and we have specially trained forensic interviewers whose sole job is to ask questions to these children in age-appropriate, non-leading fashions so that they can tell their story in their own words and not be re-traumatized as they get help.
The Philadelphia Inquirer reported that Childline, which is the state's child abuse reporting hotline, had roughly about a 50% decrease in calls for the month of April compared to the same month last year. What can that be attributed to?
That is definitely not a sign that there is less child abuse. Those of us that are in the field, unfortunately, are very concerned that children now during lockdowns, if the family member is an abuser. So in the reports of child abuse, first let me back up and give you some statistics. The best that we have with research is that anywhere between 1 in 5 and 1 in 10 children are going to be victims of child sexual abuse. 50% of the time, that abuser is a family member. So when children are during lockdown and they're locked at home with their family, for many children, this is a very safe place. And if they happen, unfortunately, to be in a situation of abuse by, say, a coach or a friend's parent, they're actually safer at home. But if the abuser is somebody in their home, then they're locked in with their abuser. When a child goes to school, there are extra sets of eyes on the children. There are after-school activities and people who care and friends' parents who can watch out for those children. They're no longer there anymore. They don't see these children. So what we're concerned about is not that abuse has stopped, but it's just not being seen and reported. We also know that in times of economic strain, we know that unemployment reports are up. We know that a lot of people are out of work. There's research that backs up that during the recession in 2008, that the incidence of child physical abuse increased because of the strain in the household. So that's unfortunately what those numbers might mean and has us all very worried.
Now, you've already mentioned with the school closures and a potential economic stress, are there other additional stressors related to this pandemic that you think may contribute to the level of child abuse that may be occurring right now?
Yeah, so this pandemic, I think, brings on different stressors than anybody has seen before. So let's go back again to the recession in 2008. There was clearly a lot of economic stress on a lot of families. Well, at least in those cases, kids were still going out to school every day. They had their own routine. Well, now, in this case of this pandemic, kids don't have their routine. They're at home. Parents, in addition to possibly being out of work, are tasked with being their children's teachers. Or it may be that parents are working and they're working remotely at home. They're expected to be working remotely while at the same time watching their children or teaching their children. That stress is enormous. Or in addition, you can have situations where a parent is going out of the home, they are working, but they're concerned because they might be bringing the coronavirus back into their family and into their home. And when this all started, we thought at least the children were relatively immune and weren't going to get sick, and if they did, it was going to be mild. And now there are reports of coronavirus striking children in entirely different ways than it strikes adults. So you have all of these additional layer upon layer upon layer of stress that are taking place in these families.
What resources are available to adults to help them to channel the stress in a healthy way?
You know, adults can start with something as simple as keeping up their own social contacts. Even with social distancing, you and I, we're talking very far apart by way of Zoom. We always tell parents to set up, say, Zoom play dates for their children. Parents can set up Zoom conversations with their friends, with their family members. That alone will lessen the stress so they can talk with other people. Make sure your kids are set up to have some downtime. It's okay during this day and age of Corona when everybody is locked in together. Sometimes we say, no, don't let your kids watch television. It's okay for them to get a break too and watch television. It's okay for parents to take a time out for themselves as well as for their kids. Take some time to sit back, to find some time maybe to read a book or to meditate. No, I know that's not going to happen in the middle of the day when there's craziness going on just from activities in the home, but try to find some time, downtime, evenings, where that can happen.
What are some common signs that might indicate abuse in children?
Yeah, so that's always a tough question, even in times of non-pandemic. All kids are going to react differently. If we're talking about physical abuse, you're going to be looking for signs of bruising. Even now, during the pandemic, for physical abuse, if you're outside, if you see neighborhood children, if they look bruised, if they look disheveled, if they look like something is just wrong, parents, adults who know kids, they can feel that. In terms of sexual abuse, kids always react very differently. You may see that a child just becomes more withdrawn, that they're not making eye contact, that they're not playing as you're used to seeing them play. Those are other signs that a child might be being abused. And sexual abuse, we're all very worried about because once again, we're talking about kids being at home, more access to the internet because they have to be for school or because parents are distracted and they're not being watched on the internet. So there is a real concern that more crimes against these children online are going to take place in terms of, I hate to say it, things leading up to child pornography or child sex trafficking. So please keep an eye on your kids while they're online.
If you're a concerned neighbor who suspects child abuse, is there any liability in contacting Childline to make a report?
Okay, absolutely not. I'm really glad that you asked that question. The more information you give to Childline, the better chance they have of helping that child, or at least looking in to see if that child and that family needs services. But you can report a case to Childline anonymously. And I'm always I hear a lot in what I do when somebody will say to me, I'm always concerned about calling Childline because what if I'm making a mistake? What am I doing to that adult? And my response is, well, what if you're not making a mistake and you don't report? What are you doing to that child by not reporting? And you know what? If you report and there's nothing going on and there's some kind of a misunderstanding, then that will be found out pretty quickly. Social services doesn't just walk into a house and remove a child from their surroundings. They will come, they'll investigate, they'll talk. That's always a last resort to remove a child. So please don't worry about calling.
Does social distancing and teleconferencing have any impact on the ability to investigate suspected cases of child abuse?
It certainly makes it much more challenging. The social workers that go out have to be careful. Again, we're talking about an infection that we're first learning about how it's transmitted. So when social workers go out, at times they may not be able to go into a child's home. They may have the child come outside. However, they are still investigating cases. They are not just letting children stay in situations that may not be safe for them. So it's being done. And in terms of therapy and social workers as well, ongoing caseworkers, they're also making use of telecommunications like we are. They can speak with a child in their home, in an ongoing case I'm talking about, not a new case. And so sometimes that's even helpful because they get an eye into the child's home in ways that maybe they never have in the past before. So it can also work to their advantage.
In an event to prevent or lessen the spread of the coronavirus in the state correctional institutions, the state's plan involves releasing certain inmates. What can be done to help address the concerns of abuse victims that might be facing the release of someone who had previously harmed them?
Yeah, there's been a lot of discussion about this at the state level because nobody wants that to happen. The orders are supposed to be, from my understanding, that the only people that would be considered ready for release are those that don't have individuals who they have hurt for being released. But if you are concerned that there is an abuser there who is currently incarcerated that might be being released, I would urge people to contact their district attorney's office and speak to them directly about the individual that they're concerned about. And the district attorney's offices should be able to help.
We've been speaking with Abbie Newman. She's CEO of Mission Kids. Thank you for joining us.
Thank you so much for having me.
After a great victory over Union forces in June 1863, Robert E. Lee marches his army to Pennsylvania. The advancing Confederates clash with General Meade's Union Army at Gettysburg. beginning the most famous battle of the Civil War. Explore our nation's past and the Gettysburg battlefield with the Gettysburg Collection. Become a member to stream the library online. Learn more at gettysburgcollection.com.
We're joined today by State Representative George Dunbar. You're sponsoring legislation that would help bring rural broadband throughout Pennsylvania. Can you explain what your proposal would do?
Certainly, Francine. During the performance-based budgeting hearings earlier this year, we reviewed some tax credits, and one of them was the mobile telecommunications tax credit, which has been around for a few years. $5 million a year goes out to that. In the hearing, we determined that 90% of the cost, 90% of those funds that were utilized would have been done anyhow without the tax credit. So the tax credit was more of they were just supplementing the companies. It wasn't incentivizing anything. So I had the thought that maybe we needed to repurpose that. The IFO also suggested maybe repurposing it as a grant, which I went and talked to Chairman Causer, who I know had some rural broadband. He's been pushing very hard for rural broadband issues. I said to Marty, I said, look, if do you have a plan? He said, yeah, but I don't have funding. And I said, well, I have funding. So we kind of married our two ideas together and put it into a bill. The bill essentially takes that $5 million annually and turns it into a grant program where companies that want to work in the broadband area, increase in broadband in our rural areas, can submit to the CFA a plan, and we will help fund it. Now, I understand $5 million is just a small drop in the bucket of what we really need to spend, but we got to start somewhere. So I think this is one of the times where some of the programs we used actually worked. You know, the performance-based budgeting exposed a weakness in our spending, and we're going to repurpose it.
Why is it a greater challenge to have infrastructure placed in rural areas of the state as compared to a city like Philadelphia or Erie?
Return on investment for the companies. It's very simple. There's just not as many customers in the rural areas. If it was as profitable, this would have been done long ago. So government's going to need to help out to incentivize some of these companies to expand into those areas. And I think this crisis has been a glaring example of why it's needed. I don't know what your house is like, but my house was my daughter home from college in one room, my wife working at her nursing job in another room, my other daughter building a hospital in another room, all using broadband. And I mean, there was more of a fight over bandwidth than anything else in my house over this crisis. Can you imagine not having that ability?
Can you explain who would be eligible for these grants and how they'd be selected?
Yeah, the different companies, not government entities, but private industry, private companies can submit to the CFA their proposals for broadband access. They will be judged on what is the most effective way of utilizing these dollars. Our preference would be for those companies that are installing new broadband as opposed to improving existing bandwidth.
And how would regions be selected regarding who takes priority, what general geographic regions take priority to receive these grants?
There'll be a board on the CFA that will determine what's best.
With Pennsylvania schools being shuttered because of the coronavirus pandemic, do you think that perhaps brings a greater impetus to get this bill to move through the legislature?
Yeah, certainly it would help. I mean, I don't think $5 million a year is going to make that big of a difference, Francine, to be honest with you. But I think at least what we learned in the last few months is the need to make sure that if anything like this does happen in the future, that we are better prepared.
Beyond the schools that I just mentioned, can you talk a little bit about perhaps other sectors of Pennsylvania that are really impacted negatively by not having access to good rural broadband?
Certainly, the most glaring would be in the medical profession. I told you about my wife sitting in my living room working, and she's working with her patients at the CF clinic, the cystic fibrosis clinic where she works, and they're doing virtual meetings and virtual doctor visits. If you don't, how much easier it would be, especially in the rural areas where there's not as many doctors. That would be the most glaring.
Where's your bill in the legislative process right now?
It came out of committee 2 days ago. We're hopeful that we could have it on the floor in the next week. If we've talked to leadership also about potentially maybe putting into a code bill if possible, but we're not concerned. We'd like just to run and have a full hearing on it. Just move it forward. I don't think anybody would be opposed to this.
What kind of response have you heard so far from your colleagues?
Nothing but positive. Nothing but positive. We have quite a few co-sponsors on the bill. When I had went and asked Chairman Rowe if he would run it and explain to him in detail what it was, he said, "That's a good bill." And it is. It's good for Pennsylvania.
As we speak on Thursday morning, the House has been considering a first of a potentially two-part budget. As a member of the House Appropriations Committee, can you explain a little bit about what is happening right now with the budget and what you see as the progression of the budget throughout the state, throughout the year?
Yeah, it is different. It is definitely different. In my 10 years, this is a different product. I've heard people say short-term, 5-month. What this really is a stabilizing budget. It's a full year budget. Education is fully funded for a full year. Both higher ed, basic ed, pre-K are all funded for a full year. But we don't, because of the unknowns, it's hard to fund everything. For instance, we've deferred collections of all our taxes until July. How do you do a budget on June 30th when you don't know what our taxes were from last year, let alone what they will be next year, as well as the uncertainty of close to 2 million people being unemployed until everybody's back to work? It's really difficult to project revenues. So we thought it was best to just do something to stabilize things. What we needed is the ability to continue going, stabilize, knowing and give peace of mind to everybody that certain things are fully funded, not only education, but debt. Our pension obligations are fully funded, and our debt and our DHS, our human services mandated costs are all fully funded. Everything else is funded for only 5 months. Now, our projected revenues right now, which are really just a shot in the dark, because we honestly don't know, and I do work in this arena very closely. We're talking about 30 billion in projected revenues as a guess. The IFO has it a little bit higher than that, close to 31, 32 billion. We're only spending 26 billion right now. So we will have money left later in the year to revisit. And when we revisit later in the year, we will have a clearer picture of our total revenues, and then we can make the hard decisions we have to make. But what we wanted to do was have something in statute now, so that our school districts have to have their budgets done. So instead of passing the buck down to them of not knowing what they have, they all now know that they're fully funded. My biggest concern was my local school districts were talking about tax increases because of the uncertainty of state dollars. Now there's certainty, and they can go ahead and do their budgets. So what will happen here is later in the year, once we have a good idea of where the revenues are, that could be September, October, November, we will revisit and pick up the rest of the budget that we haven't really finalized yet.
Who decides how that federal stimulus is utilized within the Commonwealth?
We're going to do that today. I have a meeting in about 20 minutes that we are going to go and pass it out of appropriations. There was about close to $5 billion that was on account, that was unappropriated. Off the top of that, by federal law, we had to give out to the top 7 counties about $1 billion. There's $3.9 billion left that we are going to appropriate, 2/3 of it this morning in appropriations, and hopefully it will meet with an affirmative vote. There'll be dollars for nursing homes, hospitals, our county block grant, and various areas that have needs.
What are your other priorities that you'd like to see the legislature deal with before they take their break at the end of June?
I think that we need to have a clear and concise view of where we're going. What is the color system, red, green, yellow? What does each entail? Our people want, just like I said, we want certainty. We need to know what we can and can't do. Nobody's looking to violate laws, but we want to know, it's like, when can we reopen? When can we go and to a restaurant and have something to eat? What are we allowed to do? Our businesses want to open, they want to get to work, but they want to do it within the guidelines. We need guidance from the governor's office as to how exactly that can take place. I think that is our priority one right now, is to have an understanding between the General Assembly and the administration of what each level means. Our numbers have been good, but that doesn't mean we're out of the woods either. So we need to make sure we're doing it in a safe manner.
We've been speaking with State Representative George Dunbar. Thank you for joining us today.
No problem, Francine. Thank you.
For 25 years, PCN Tours has provided Pennsylvanians with a look into manufacturing businesses across the Commonwealth. Each episode is led by a company expert, giving you an unscripted, in-person experience. Watch what makes Pennsylvania a unique and exciting place to work and the opportunities it presents with PCN Tours on cable and streaming. PCN, Pennsylvania History and Culture.
I'm joined today by Matt Smith. He's president of the Greater Pittsburgh Chamber of Commerce. What do you hear from Western Pennsylvania businesses, particularly reaction to how the governor has responded to the coronavirus pandemic?
Yeah, what we're hearing from businesses, and I should add, we conducted a survey of about over 300 of our members here in Western Pennsylvania. The thing that we're hearing is that they believe that we as a region can move forward with a robust reopening, but at the same time, protecting the most vulnerable citizens among us. And here in Western Pennsylvania, in the Pittsburgh region, we've had a relatively low infection rate of COVID positive tests. And I think the reason is because very early on with our political leadership, we collaborated, the business community, philanthropic community, labor community, really worked very well together in flattening the curve very early on. And so I think that's led us to be able to move through the phases from red to yellow, and we're very hopeful that in the very near future, we'll ultimately move to the green phase as well.
Well, since you mentioned the phases, Allegheny County moved to the yellow phase, I believe, mid-May, like May 15th. How are businesses doing at rebounding so far?
They're doing very well. They're adapting. There's a lot of innovation in the Pittsburgh region occurring during the reopening. I think that the things that we're hearing from business owners and really from the community as a whole are very similar to what a lot of communities are experiencing. They want clear and consistent guidance from local, state, and federal authorities, that once they know what that guidance looks like, businesses will do right by their employees, they'll do right by their customers, and they'll make the changes that they need to make. So what we're hearing is a lot of businesses want those guidelines to be clear and consistent, because they're taking the preparations right now to make sure that their workplace is as safe as possible. And that could take the form of retrofitting the actual physical layout of the workplace. It could take the form of communicating with their employees in terms of their ability to do telework. And so a lot of businesses right now are going through that preparation process, because the thing that we've heard quite a bit out here is that there's a real interest in kind of moving away from what many would call the false choice between public health and the economy, and looking at this in a much more strategic way, where we're reopening the economy, but at the same time protecting the most vulnerable citizens in our region.
How would you describe consumer confidence at this time? Are residents ready to return to retail and perhaps outdoor dining in the near future?
Yeah, I think they're very ready to do that. I think that the region is ready to move ahead with, particularly things like outdoor dining. I know the governor just announced for counties, which our entire footprint, except for Lawrence County, which has moved into green, the yellow phase counties, if you will, are able to have outdoor dining. And I think there's going to be among the public a real receptivity to that, because I think, again, the real key thing for us is for businesses and any organization that's reopening to build that trust and confidence. And I think, in the Pittsburgh region, we've been very fortunate in working, as I said, with our political leadership, with the business leadership, to make sure that everyone is collaborating on the precautions that we know our public health officials have told us to take. Things like washing your hands, wearing masks. And we've tried to get the message out and communicate very clearly that something like wearing a mask is not a sign of weakness at all. It's actually a sign of strength and collaboration and respect for your neighbor. And it's going to be through those individual actions the way that we can reopen faster in a more robust manner than maybe some other regions throughout the country.
When you interact with businesses, what are their biggest concerns right now?
Yeah, the big one that we hear about is, going back, and it's related to the clear and consistent guidance issue, liability issues moving forward. As businesses open, as organizations open, and liability protection is really something that will apply across the board. It applies to your Main Street businesses in a very direct way when their customers or employees are entering their stores. It applies to manufacturers who have pivoted their operations in many cases from an operation to something right now that is directly related to the pandemic, like manufacturing hand sanitizer or PPE. It also applies to hospitals and healthcare workers who have obviously been on the front lines of this battle with the pandemic. And it also finally applies to publicly traded companies with securities litigation. And so we really think the liability issue is paramount as we reopen the economy in order to provide businesses, child care centers, nonprofits with the assurance that if they're operating in accordance with local, state, and federal guidance, that they will not be held liable and have to incur the cost and the time that litigation would take. And that's really, I think, going to be a very important issue moving forward. I think it's really important to note on the liability issue, though, that what we're really asking for, both at the state and the federal level, is a safe harbor so that those businesses doing it the right way have a level of liability protection. There would still be accountability, and certainly justifiably so, for any operators who were engaged in gross negligence, willful misconduct, and those sorts of things. So those operations would not have a defense. But we really think in order to build the trust and confidence among the members of the business community and organizations that are opening, that liability protection and safe harbors are really, really, really critical piece of the reopening.
There are a number of businesses that are only allowed to operate with a limited capacity. Restaurants, for example, come to mind due to spacing issues. Do you anticipate any additional assistance will be available to help these businesses survive?
Yeah, I think that as the federal phases move forward, one of the more critical components over the next couple of months is going to be exactly that support, Francine, supporting those organizations and businesses because of social distancing restrictions are not going to be operating at 100% capacity. So think the restaurants, the large entertainment venues, large theaters, anything in that regard, I think is going to need additional assistance from the federal government. I know there's various pieces of legislation circulating in Congress to do exactly that, but we think it's really important to have some bridge financing in place so that those businesses who by virtue of the social distancing restrictions are not going to operate at 100% capacity, have some sort of bridge assistance to the other side of the pandemic.
What kind of resources are currently available to help guide businesses if they have questions about how to proceed according to state or federal guidelines?
Yeah, we at the Allegheny Conference have put together a website, readypittsburgh.org, that is in place right now that provides a number of local, state, and federal best practices, guidelines, so that employers know exactly what is going to be expected of them, what is going to be required to build that trust and confidence that I alluded to earlier. And so we really view one of our most critical roles, has been over the last couple of months as well as into the future, is providing that real practical information that organizations and businesses are going to need to know and implement for the reopening.
As you've mentioned, several counties are beginning to move into the green phase now. What will the new normal look like in Western Pennsylvania?
Yeah, I think in some ways it'll look like the way we're operating right now. We'll continue to require and certainly be expected of people to wear face masks, to still do social distancing. But again, I think one of the strengths that we have here in Western Pennsylvania is our ability, working with our universities, with our healthcare providers, with our public leadership, to make sure that when we move into the green phase, the testing is adequately ramped up. The contact tracing is in place. And we think as a region, the Pittsburgh region is really uniquely positioned with those healthcare assets and public sector leadership to move into the green phase in a very strategic and seamless way. I'll give you one example. In Allegheny County, it's one of the few counties in Pennsylvania to have its own health department. And so that Allegheny County Health Department, which is led by Dr. Deborah Bogan and our county executive, Rich Fitzgerald, they've worked hand in glove with the business community and other leadership in the Pittsburgh region to make sure that those basic requirements, the testing capacity, the contact tracing capacity, is in place now, and that will only be ramped up in the future as we move into the green phase. And we view this as a very non-linear process. We think that we're going to have to be very strategic with how we're operating. We know the virus is going to be among us for the foreseeable future, and so we think with those public infrastructures in place, we think we're very well positioned to move through the green phase, and as I said, continue to expand the reopening of the economy.
We've been speaking with Matt Smith, president of the Greater Pittsburgh Chamber of Commerce. Thank you for joining us.
Thank you, Francine.